9 early signs of dementia that often go unnoticed, and 13 classic symptoms you need to know. Could memory lapses signal something more concerning than just typical aging? Have you considered if dementia can be prevented and how to recognize its early indicators? Today, we'll answer these vital questions. Dementia affects millions of people worldwide, yet many still mistakenly believe it's an inevitable part of getting older. But is that really true? In this video, we'll dive into what dementia truly is, explore the most common types, and outline 9 early signs that could indicate its onset. Additionally, we'll discuss 13 classic symptoms and share effective strategies for maintaining cognitive health. Imagine if you could take actionable steps now to preserve your brain function. Watch until the end to discover the latest advancements in dementia treatment, offering renewed hope to millions. 1. Struggling with words. Difficulty finding the right words during a conversation may signal early cognitive decline. This goes beyond occasional forgetfulness, as the person may hesitate frequently, rely on vague terms, or substitute inappropriate words that don't fit. They might confuse the names of familiar objects or experience long pauses trying to recall specific terms. At first, this can seem subtle and mistaken for normal aging or distraction, but as it becomes more frequent, it starts to interfere with daily communication, causing frustration and social withdrawal. Recognizing persistent language struggles early on is crucial for timely diagnosis and support.
2.
Changes in the senses. Sensory changes, particularly in vision, hearing, smell, and taste, can be important indicators of dementia. The person may struggle with recognizing familiar faces, judging distances, or navigating spaces, leading to accidents or missteps. Hearing issues in noisy environments can cause misunderstandings and social isolation. Changes in taste and smell might reduce interest in previously enjoyed foods, impacting appetite and nutrition. These subtle shifts can significantly affect quality of life and indicate underlying cognitive decline. 3. Lack of motivation. Apathy, or loss of motivation, is another early sign of dementia that often goes unnoticed as it develops gradually. The person may neglect hobbies, avoid social gatherings, or appear emotionally distant without typical signs of depression. Over time, this detachment can impact relationships and daily functioning. Recognizing apathy early is important for timely intervention and support. 4. Muscle weakness. Muscle weakness may be linked to the brain in conditions like vascular dementia and Lewy body dementia. This weakness manifests as fatigue, difficulty with precise movements, or reduced motor control, making routine tasks like buttoning a shirt or using utensils challenging. Frequent falls, trouble maintaining balance, and reliance on support for movement are also common. Early intervention can help manage these symptoms and potentially slow progression.
5.
Lost in familiar places. Spatial disorientation is a concerning sign often observed in early dementia stages. A person may become lost in familiar settings, struggle with directions, or experience confusion in well-known environments like their home. This can lead to anxiety and impact their ability to move independently. Early recognition and support are pivotal for maintaining safety and quality of life.
6.
Sleep problems. Sleep disturbances are often overlooked but can serve as important early indicators of dementia. These disruptions in sleep patterns may manifest in various ways, including difficulty falling asleep, frequent awakenings throughout the night, or experiencing excessive drowsiness during the day. Such changes are not just inconvenient, but may signal underlying issues with brain health. One specific phenomenon linked to dementia is sundowning, a condition characterized by increased confusion, agitation, and restlessness during the late afternoon or evening. Sundowning can disrupt not only the individual's sleep, but also the routines of caregivers and family members, leading to heightened stress and challenges in daily living. The importance of addressing sleep disturbances cannot be overstated, as restorative sleep plays a critical role in maintaining cognitive health. During sleep, the brain undergoes essential processes such as clearing out toxins, consolidating memories, and regulating emotional well-being. Persistent disruptions in these processes can exacerbate cognitive decline over time, potentially accelerating the progression of dementia symptoms. Strategies to manage sleep problems in individuals with dementia include establishing a consistent bedtime routine, creating a calm and comfortable sleep environment, and minimizing stimulants like caffeine or screen exposure before bed. In some cases, professional medical advice or therapeutic interventions, including medication, may be necessary to improve sleep quality and overall well-being. 7. Hunched posture and difficulty walking. Postural changes and difficulty walking may indicate cognitive decline, especially in conditions like Lewy body dementia. Early signs include a hunched posture, muscle stiffness, and hesitation with movement. Over time, walking patterns may become slower or more unsteady, increasing the risk of falls and loss of independence.
8.
Simple tasks becoming complex. Tasks that once required little effort can feel overwhelming as dementia progresses. Routine activities, such as preparing meals or paying bills, may become confusing, leading to frustration and dependency. Recognizing difficulties in daily task management underscores the importance of early diagnosis and support.
9.
No interest in even talking. Apathy or anhedonia is a common yet frequently misunderstood symptom associated with dementia, often manifesting as a noticeable decline in interest and engagement in activities, hobbies, or social interactions that once brought joy and fulfillment. Individuals experiencing apathy may seem emotionally distant, unresponsive, or indifferent, often withdrawing from family, friends, and previously cherished pastimes. This lack of enthusiasm can deeply affect their relationships, leading to feelings of frustration or helplessness among loved ones and caregivers. In many cases, apathy may be mistaken for depression, as both conditions share similar traits, such as reduced motivation and emotional expression. However, unlike depression, individuals with apathy typically do not exhibit significant sadness or despair. Instead, they may appear disengaged or indifferent. This distinction is important for ensuring appropriate care and support strategies. The impact of apathy extends beyond emotional well-being, often contributing to a decline in overall quality of life. Reduced participation in meaningful activities can accelerate cognitive and physical deterioration, further isolating the individual. Recognizing and addressing apathy is a critical component of dementia care, as early intervention can help maintain a sense of purpose and connection. Strategies to combat apathy may include encouraging gentle involvement in familiar activities, fostering social interactions, and creating a structured daily routine to provide a sense of stability. Caregivers can also play a vital role by offering consistent support, patience, and understanding, while healthcare professionals may explore therapeutic approaches or interventions tailored to the individual's needs. By addressing apathy proactively, it is possible to enhance emotional engagement, preserve relationships, and improve the overall quality of life for those living with dementia. 13 classic symptoms of dementia. Difficulty following conversations is a common and often early sign of dementia, as individuals may struggle to process information, keep track of a discussion, or respond appropriately. This can lead to frustration, misunderstandings, and withdrawal from social interactions. Similarly, a loss of time awareness is another key symptom, where individuals may forget dates, days of the week, or even the time of day, causing confusion and disorientation in daily life. This often goes hand in hand with difficulty making decisions, as dementia can impair critical thinking and problem-solving skills, making even simple choices feel overwhelming. Social isolation is frequently a byproduct of these challenges. As individuals become more aware of their struggles, they may retreat from social situations to avoid embarrassment or frustration. This isolation can further exacerbate the progression of dementia, as social engagement is critical for cognitive health. Compounding this issue, inappropriate behavior may also emerge, as individuals lose the ability to adhere to social norms or regulate their emotions. Such behavior can create strain in relationships and lead to additional social withdrawal. Short-term memory problems are among the most recognized symptoms of dementia. Individuals may frequently forget recent events, conversations, or where they placed items, leading to repeated questions or misplaced objects in inappropriate locations. This memory loss can cause frustration for both the individual and their caregivers, often highlighting the decline in cognitive function. Alongside these memory challenges, individuals may experience hallucinations, which can involve seeing, hearing, or sensing things that are not present. These episodes can be frightening and further contribute to confusion. Understanding these early signs and symptoms is vital for timely diagnosis and intervention, ensuring individuals and their caregivers can manage the condition effectively.